Hello students and welcome. Today we are diving into an essential part of your training, Module B, Infection Prevention. As a nurse aide, your role is vital in keeping our residents safe. Remember, our goal is care that moves with you. By the end of this module, you'll understand the chain of infection and how to break it to protect everyone in your care. So, what is an infection? It's simply a condition that occurs when harmful germs get into the body and grow in number. A localized infection affects just one part of the body. You might notice redness, pain, or puffiness in that specific area. A systemic infection affects the entire body or a whole system, often causing symptoms like fever, chills, and fatigue. Different infections have different signs, from stomach pain and nausea to bladder discomfort or a persistent cough. These invaders are called microorganisms, or more commonly, germs. They are everywhere and can be both helpful and harmful. We practice medical asepsis, also called the clean technique, to remove or destroy germs and prevent them from spreading. To prevent infections, we must understand the chain of infection. This chain has 6 links that allow germs to spread. Link 1 is the causative agent, the harmful germ like a virus, bacteria, fungus, or parasite that causes the infection. Link 2 is the reservoir, which is the place where germs live and multiply, often within the blood or skin of a person. Remember, some people are carriers. They don't show any symptoms but can still pass the germs on to others. Because you can't always tell who has an infection, we must treat everyone as a possible reservoir for germs. Link 3 is the portal of exit, the way germs escape, such as through the nose, mouth, skin, or digestive tract. Link 4 is the mode of transportation. This is how germs travel from place to place, most often by our hands. Germs travel through direct contact with body fluids or indirect contact through objects that an infected person has touched. Germs can also travel through infected animals, insect bites, or even contaminated food and water. Link 5 is the portal of entry, any opening on a person's body, like the mouth or a break in the skin, that allows germs to enter. Finally, Link 6 is the susceptible host, someone at risk of becoming infected, often due to age, illness, or stress. You can break the chain by getting a flu shot, staying home when you are sick, and covering your mouth when you sneeze. Break further links by washing your hands, covering open sores with bandages, and maintaining a healthy diet. An HAI is an infection acquired while in a hospital or other healthcare facility. Your diligence helps prevent these. The CDC recommends 2 levels of protection for the public: standard precautions and transmission-based precautions. Following these rules protects not just you, but also your family, visitors, and the residents you care for every day. Hand hygiene means washing with soap and water, or using an alcohol-based hand sanitizer with at least 60% alcohol. Performing hand hygiene correctly is the single most important thing a nurse aide can do to stop the spread of infection. You must wash your hands immediately before touching a resident, after contact with body fluids, and after removing gloves. Also, wash your hands upon arrival at work, after using the restroom, before eating, and after handling trash. Use soap and water if your hands are visibly dirty. Use a hand rub before and after routine care or handling food. This brings us to PPE, or personal protective equipment. These items block germs from reaching your skin and clothes. Always wear gloves during mouth care, wiping a nose, or anytime you might come in contact with blood or body fluids. Wear a gown to protect your clothing and a mask to prevent breathing in germs through the nose and mouth. Sharps are items with edges that can cut or pierce the skin. Be extremely careful and always wear gloves when handling them. Never recap a needle or put anything sharp in a regular trash can. Always use the designated red sharps container. For floor spills, put on gloves first, absorb the spill, clean the area, and apply a disinfectant according to facility rules. Whenever blood or body fluids get on any surface, clean it immediately using the products available at your facility. Beyond standard precautions, we have 3 specialized levels based on how specific infections spread. Contact precautions prevent spread by touch. This requires you to wear both a gown and gloves to protect everyone. Droplet precautions are for germs that travel through the air in small drops, which requires you to wear a mask for safety. Airborne precautions are for germs that float long distances in the air. This requires a specialized respirator mask. Residents in long-term care are more susceptible to outbreaks like the flu, so your vigilance is their best defense. We must also be aware of bloodborne pathogens like hepatitis and HIV, which spread through contact with infected blood. If you are exposed to blood or stuck by a sharp, follow your facility's exposure plan immediately for your safety. You have a huge responsibility to protect yourself, your family, and your residents from these infections. By following these simple steps, you are providing the highest quality of care. Thank you for all that you do. That concludes Module B on infection prevention. We'll see you in the next lesson.